The Northern Territory's ambulance service reached a critical failure point this weekend, and for duty manager Samantha Cooper, this came as no surprise.
It's never off the cards for me. It's not something that I don't think is ever not going to happen. Unfortunately, it did happen, and unfortunately, it will happen again until something changes.
In just 7 hours, St John Ambulance received 144 calls for help. More than 60 had to be abandoned and 14 life-threatening cases were left waiting, one for over 5 hours.
So unfortunately, it got to the point where we had to ask our crews to forego their meal breaks and their fatigue breaks during that high workload or high demand period. We're asking people to almost give up their human rights.
Having already worked 12-hour shifts, exhausted crews were asked to stay back, putting both patients and staff at risk. Yesterday, the Territory's Health Minister, Steve Edgington, said in a statement additional resources and support staff had been provided to St John to help ease the pressure. But the ambulance service says they're yet to see any change.
I haven't seen an extra resource for many, many years within this organisation. So unfortunately, something, like I said, has to change. Like, they need to start listening to us and understanding that we are an essential service.
The state of the service particularly worrying for the Territory's older population.
And wouldn't it just be horrific when you know your loved one could have been saved and safely in hospital with all the care they need, yet they can't get there? What sort of country do we live in? We're not a third world country.
Questions many locals are now demanding answers for. Courtney Barrett Peters, ABC News, Darwin.